In 2017, I almost closed my clinic due to low profitability and a chaos. I simply didn't have any system. Watch this video until the end, and I'm gonna share with you 5 not simple, but 5 steps I implemented during all these years to create a system and profitability within my clinic. We see about 5,000 patients per month at this point, and it's definitely a journey. Hi, my name is Ina Lee, and this is Dasha, my assistant that's helping me today. I'm a licensed marriage and family therapist. I'm also an owner of 2 businesses. Okay, let's talk about some strategic decisions I made for my clinic that helped me to turn it into a very profitable clinic. Step number 1, increase revenue and the profit margin. So if you're a cash provider, then you want to think about increasing or raising your cash prices. That might be easier. However, like for us, we're an insurance provider, and it's not easy to rate negotiate with insurances. So you kind of have to be creative and think about plan B. So what I did is I added a higher profit margin services. And for us, it's psychiatry. Also think about something that might benefit your clients. That could be a digital product. It could be a wellness product, anything that fits well you and your client. Think about upsell and cross-sell, like a whole ecosystem within your practice. Speaking about the rate negotiation with insurances, there are some tactics that I would like to share about we use. First of all, we do rate negotiation with insurances every single year. And we ask for a much higher rate based on your unique positioning. That could be a specialty, which is great. If you have a specialty, it's awesome. But if you don't have a specialty, maybe it is your unique position, maybe a multi-location, maybe a multidisciplinary team, and so on. Make your research and also research for the average market rate that is being paid out to other providers within your geographical area. I'm going to add one more tip. If you're a provider that just thinking right now to add insurances and to be credentialed with insurances, maybe you don't want to accept a low rate from the beginning because it's going to be harder for you to negotiate those rates. Make some research and see what's appropriate for you, thinking about the average prestation you would like to accept for yourself at this point. Step number 2, reduce expenses. But to reduce your expenses, you need to be conscious of your expenses, and you need to now see your expenses. It took me time, really years, before I was able to establish some financial system and put all the expenses, understand all the expenses, first of all, which one belongs to what, and put them in a systemic approach in my P&L in QuickBook. So first step is to make all expenses conscious. Do you have any expenses that you're not aware of, and maybe they just don't belong to the company, or maybe you don't need to have them anymore? So I started to search, and I found a company that helped me to learn about finances. I really studied that, and also to help me to develop and structure and establish a financial system and put everything in the P&L in a QuickBook. So what we do within our company, we do weekly monitoring of financial expenses. We know how much we need to spend on a weekly, on a monthly basis. We kind of predict how much expenses we're going to have. Everything is so conscious at this point. So it's going to give me a sense of control and the power. I'm not going to give you any complicated information in the formula, but I'm going to give you some insights about that. Within my clinics, of course, you know, if you're a group owner or any owner of any business, we needed to know what is gross profit margin. Gross profit margin is with revenue, you deduct the cost of people producing the revenue. right? In us, it's payroll. Gross profit margin is not net profit margin. Why? Because after the deduction, let's say for my clinic is payroll, you have other expenses. You have rent, you have HR, CRM, liability insurance, you name it. In the United States, the profit margin for the outpatient mental clinic, an average, it's about healthy profit margin. I would say 20%. Anything above 25%, it's absolutely excellent if you can. You want to try to get, the higher the profit margin is, the better. Nowadays, just because we struggle, especially the people that have accept insurances, the profit margin is still low. According to the current statistics, our profit margin right now is something between 5 to 7%. It is not enough. If you have such a low profit margin, think about some of the steps I listed for you. What I did creatively for myself, and I know this advice and this tip I shared with many others, and it helped many clinics or maybe even some solo providers. We outsourced some of the administrative processes and services to people that not within California. We know California is probably really expensive, and the cost of labor is really expensive as well. So if you can outsource some of the services to other people, whether it's a different state that are cheaper or maybe different country, you will automatically increase your profit margin. It's gonna cost you cheaper. I lead a global alliance of mental health providers. It's a community that I have been building. It's across all states within the United States, and now it's expanding to other parts of the world, where I unite people within the industry, and they can get free information about rate negotiations, about insurances, about financial struggles, and how people share their tips and advices to help them be successful. I know what's going on within the mental health industry today because I'm myself a mental health provider and I own a clinic. It is really challenging to be successful, and it's really challenging to be profitable. If you are a mental health provider and you are struggling with your practice or with your business, if you would like to learn more information about insurances, about strategic decisions, about some tips and advices, I invite you to join us in our Facebook community, Global Alliance of Mental Health Providers, where thousands and thousands of people from across all states share their own experiences and information that support people and unite people. Step number 3, create optimization in your business. I'm gonna give you my journey, my insight about that process. That was painful. In order for me to even understand what to optimize it, I needed to create a systemic approach to my clinic or to my even businesses. And I needed to study and hire even a company that's still working for me for 7 years actually. We created an organizational structure, an org structure. Besides this, we also built systems, a systemic approach. Why? Because we wanted to optimize all the system. Let's talk about the automation. Automation is needed. What's possible where you can do it from the beginning, or where you can you can do it later on. One of the automation is we working through right now with AI. I know it's a painful topic for some people, and some people have different opinions about AI, but I'm just gonna give you some example of processes that we build in our clinic. We use AI right now for the phone call and triage system. So what AI does is automatically picking up all the phone calls and then triaging the patients or the clients to the department they need. That could be a simple new client and having an intake. It could be a follow-up appointment, but it could be a medication question or a billing question. No matter what they need, the AI would triage it. We had recently a situation when it was a glitch and the AI stopped working, and instead of maybe like having like 500 phone calls per day, we had thousands of phone calls per day. That was really painful for us because we didn't have enough, people to pick up the phone. When the AI really systematically triage it to different departments, it reduces the time and the cost for you and optimizing all the system, and eventually you have a higher net profit margin. Any other systems that you can think about, and then the platforms that you can use. For example, we use CRM or any EHR system, and it can help you to optimize any processes. Use it. Let's talk about finances, the billing, and optimization of this process, the revenue cycle. We work right now currently, it's nonstop. We work on account receivables. Anywhere within, by statistics in the United States, the account receivables can vary. Some can be between 7% to even some companies or hospital might have even higher, between 25 to 30%. This is really high, and you want to optimize it. For example, I had to work for almost 10 years to build my billing team and my account receivable team to achieve 95-96% of account receivable collections. If you are losing money or leaving your money on the table and your account receivable rate is higher than, let's say, 5%, between 5 to 10% or even higher, you want to optimize it. Same revenue, same processes, just increase the collection and you're going to have better and higher net profit. Step number 4, control cancellations and missed sessions rates. For us right now, it's actually number 1 in our clinic. We're still working on it, and we're still trying to optimize it, have a higher productivity. In any healthcare industry or mental health industry that we have clients, anything can happen. They can be sick, right? Or simply, maybe the client is not conscious about the attendance, that the psychotherapy is done weekly. For example, right now in our clinic, the missed sessions cancellation rate is about 15%. For some of the larger clinics in the hospital, I heard that it could be 20, 25 and higher. I would highly not recommend to do the 20, 25, and then 15% for me is really high. My goal is right now to reduce from 15% to maybe about 10%. And when you track your numbers and you see the productivity of your clinicians or yourself as well, that will trigger you to really think about what is involved in this process. One of them is, of course, the productivity of clinicians. And it could be simple policy of attendance of a client, where when you discuss with the client the therapeutic issue of the attendance for psychotherapy, can you increase it? If there are some clients that are still not consistent with their attendance, you want to discuss it, and the client is still not realigned with your value or your value system, maybe perhaps you might need another client that is more attendant and more motivated to attend psychotherapy sessions with you or psychiatry sessions with you. You want to think about the churn rate, where the patients or the client, or LTV, we call it in business, lifetime value, for how long they come to you or to your clinic. In average in the United States, psychotherapy, clients stay for about 12 to 16 sessions and so on. If anything, I would say below 12 sessions or less, maybe client living in 5 sessions or less, there might be 2 things. One is you're highly efficient clinician, if we're talking about psychotherapy. But a second, it could be that maybe you want to think about building a rapport with the client, or there might be something else, another issue when the patients leave too soon. You want to investigate it. And this is related to not only psychotherapy, but psychiatry as well. We actually collected some information to track and to see what's going on within the clinic just in general, and then per each clinician. It helped us to build a picture and also to have a strategic decision. And we work on it actually every week and every month. We track it. Some information for you to really think about. That was definitely an insight for me. If we have a late cancellation missed sessions about 15%, and let's say you stay within the same revenue, you don't have to work on increasing your revenue, but just reduce your late cancellation missed sessions to 10%, the 5% adding to your net profit without really working on getting either more clients, or quantity of the patients decline for yourself. If you are a mental health provider, whether you're solo or group owner or clinic owner, I invite you to sign up and join our Global Alliance of Mental Health Providers so you can get free information, support, and education in your journey. Step number 5, track your marketing expenses. I know some of the clinicians, some clinic, they don't really have some of the marketing expenses, but for those that really actively market, like myself, we spent about probably $250,000 per marketing per year at this point. Of course, we would like to know what is the marketing expense? What is the conversion lead? Do we have enough leads? Is the conversion is high enough? Why? Because the cost per lead and the cost per conversion might vary, and you want to optimize it, because immediately for the same cost of marketing, you might have simply higher conversions and higher intake, just maybe by adding and calculating number of the admins within your clinic. Or maybe you just need to optimize your marketing, or maybe Google Ads, and then you're just gonna have higher number of the leads. Anyways, whenever you're working with the marketing, you want to track it because it is an expense and part of the P&L. Let's review and summarize our today video about how to increase profitability for your practice. Number 1, increase revenue and profit margin. Number 2, reduce your expenses. Number 3, create optimizations and automation. Number 4, control your cancellation and missed sessions rates. Number 5, track your marketing expenses.